Imagine you, as a child with autism, cannot live in your own skin, that everything around you makes you feel uncomfortable. Loud noises, bright lights, the sound of other children playing make every reason to reject the things in their environment.
What about now?
Autism is a neurobehavioral disorder that actually is based in brain development. It is not a mental health disorder.
Hi, I'm Mitch Holtis, and you can usually hear my voice telling you about the latest battle the Chiefs are engaged in on the field. But today I want to talk to you about a more important fight, the fight to help children with autism. Autism is a complex neurobiological disorder that typically lasts throughout a person's lifetime. It is part of a group of disorders known as autism spectrum disorders. It occurs in all racial, ethnic, and social groups and is 4 times more likely to strike boys than girls. Autism impairs a person's ability to communicate and interact with others. There is no known cause, laboratory test, or cure for autism, but there is hope. Children with autism can dramatically improve if provided access to early diagnosis and early intensive behavior therapy.
As a medical disorder, autism is very much like diabetes, leukemia, kidney failure, many other diseases that the earlier you catch the disorder, the earlier it is diagnosed, the better off that child will be.
Well, when we first noticed that Sierra wasn't quite the same way as other children, she threw tantrums 10 or 15 times a day. She wasn't speaking, and she was doing things like walking on her tiptoes, running around in circles without any purpose. The diagnosis itself wasn't a surprise to us because we had pretty much anticipated that's what it was going to be. But the process was quite a process, and of course the expense. It was very expensive to get the diagnosis in the first place.
It is very difficult to diagnose many children with autism, and that's really important, but physicians are frustrated for a couple of reasons. First, for diagnostic problem, once you have a positive screen, you can't get diagnosis because you have to refer to a diagnostic team that has a long wait list, or that the insurance won't cover, or is hundreds of miles away. And the second part of the problem is there are no services. And the reason there are no services are because there's nobody who is reimbursing the providers to get the services. And so when you implement screening testing, the idea of implementing screening for any kind of disorder is that you diagnose early and that you have something to do about it. And we need to change the system so we can do both those things.
What about now? What about today?
We must save our families. A diagnosis of autism has a huge impact on the families. It affects the parents, it affects the other family members, it affects their employment, and it affects their finances.
Basically, we were told from the very top, if my child either had cancer or had a stroke, they could possibly pay for speech therapy, but they would only pay for speech therapy. Well, since Josh didn't have a stroke or cancer, they wouldn't pay for anything. So we took on the responsibility of paying them out of pocket. So that meant my husband's 14 years of working in one company. We took his retirement fund out. Then we decided to put a second mortgage on our home. I only have so much money. I couldn't afford gas anymore to put gas in my van to take my boys to the developmental preschool. And I think that was one of the hardest things I had to do as a parent, is look in my child's eye and say, I'm sorry, son, we can't go to school today because mommy can't afford it.
As a single mother, you really try to use the resources that are around you. I don't know what I would do if it wasn't for my parents. Sorry. They're a second set of parents to them. They watch over them and take care of them, and I don't know what I would do if I didn't have that. I don't know how I would be able to survive without that.
Insurance needs to cover the diagnosis of autism. Autism is a medical condition, and insurance covers other medical conditions. We also know that treatment changes the biology of autism, and there's increasingly good evidence that we do early intervention, it changes the gene expression in brains that are growing. And so insurance needs to cover that. And it is a matter of social justice. Other neurologic conditions are certainly covered, and autism shouldn't be excluded.
So after approaching to get pre-authorization, I made the appeal to reverse that decision, and that written appeal was denied. I subsequently went and had a hearing. That appeal was denied. So at that stage, coincidentally, I happened to be the chief operating officer of a health insurance organization at the time. I approached my board and shared with them. They were flabbergasted at the denial, and we were in the business.
So I got the first letter of denial. First it was because that was experimental, even though the doctor they had sent us to had said, this is exactly what you need. And then it was because there wasn't a in-network provider, and then they told us because there wasn't a license in Kansas. It was just one thing after another. In the middle of all this, we were still fighting the battle, thinking, they've got to listen to us. This has got to be paid for. He has to have this. There's no choice, you know. So your choice is to either say, okay, my child can be institutionalized for the rest of his life, or he can get this therapy and he can actually maybe go to first grade with his friends and learn and be a protective member of society and be the little boy that all the dreams that before you got the diagnosis happened would be. The credit cards are long maxed out and we have no savings. My parents even took out a second mortgage to pay for this. Thank the Lord they did that. And that's where we're at. We are in debt immensely, but to not do this for him, that would have been even worse.